Now, guidelines, kind of boring stuff, but it shouldn't be. Guidelines are not the gospel. They're simply evidence-based recommendations as best we can make them to guide clinical decision making. And they don't replace clinical experience and clinical judgment and discussion with your people. They're not intended to do that. They need a lot of mixing in with clinical judgment. We have guidelines all over the place, and this is the biggie that was launched as one of a trio in December 2003 with the stroke guideline and the diabetes guideline. And what was new then, just look at the bold print in the middle there. For the first time, we brought everything together into this absolute risk construct. You know, the color charts? Now, believe it or not, we sort of have led the world in that. You know, in the previous guidelines, we required fasting bloods to check the lipids and glucose. Don't need that. If your patient comes in non-fasting, as they often do, you don't need to lose them. Get a blood, and instead of the fasting blood glucose, you can take the non-fasting hemoglobin A1C. It's really a simple, practical thing, and if it's above 6%, you need to get them back and check the glucose, chase after them. We brought kidney function in and up. It's really important, particularly in diabetics. For lipids, suffice to say we're getting more aggressive at getting the cholesterol down, more statins being used, and thanks to Pharmac for that. Blood pressure likewise, a little more aggressive, and reassessing at the intervals recommended. If they're low risk, every 5 years will do. If it's intermediate, then every 2 years. So there are quite a lot of small changes, but altogether I think quite important. And you need to do it systematically, not just when people cruise by. Get onto your registers, get teamed up and sort it out. And go to the high risk groups first, and it's got to be appropriately culturally fitted. And One Heart, Many Lives is the supreme example. And it's getting your community to come on over, not just waving a big stick at them.